Now switch to a panel discussion on Cuban innovations in biotechnology and disaster mitigation strategies. As I mentioned earlier, life-saving treatments are being developed to improve quality of life for lung cancer patients and diabetics, even while developing a vaccine for Texas cattle fever, a disease carried by ticks that is a constant threat to the livelihood of ranchers along the border with Mexico. We will also discuss disaster mitigation. Cuba has avoided Katrina and Sandy type aftermaths through advances in planning strategies that are working. So what are they doing in Cuba that we're not doing here? We have three distinguished experts to provide more information on these innovations. Our first panelist is Dr. José Luis DiFabio, an international vaccine researcher and public health expert who most recently served as the Pan American Health Organization, in other words, World Health Organization representative in Cuba, where he, among other responsibilities, documented Cuban biotechnology as well as Cuba's programs for direct medical assistance and development of human resources for health in more than 100 countries around the world. Our next panelist will be Barbara Morita, a physician's assistant and a member of a disaster medical response team based in the US. She has firsthand disaster response experience serving on response teams at the World Trade Center, Hurricane Katrina, and tsunami recovery in Indonesia. Ms. Morita's approach to disaster medical response combines experience as a US disaster medical responder, disaster preparedness field research in Cuba, and service to medically underserved communities in the US. Our last panelist is Gail Reed, a founder of MEDICC and executive editor of MEDICC Review, which is the only English peer-reviewed international journal of original research by Cuban authors on population health and medicine. Ms. Reed was most recently a featured speaker at TED Med in 2014, presenting on the Latin American Medical School, which you just heard about. The video, Where to Train the World's Doctors, Cuba, is featured on TED.com. So before we begin the discussion, I'd like to show you a short clip of a recent report in the news about a medication in Cuba that is helping diabetic patients with foot ulcers avoid amputations.
We're back now with hopeful news for the 21 million Americans diagnosed with diabetes. It comes in the form of a drug made in Cuba that's now used in more than 24 other countries, but not here in the U.S. Doctors are hoping the recent diplomatic breakthroughs will make it possible that that drug can come to America. NBC's Harry Smith has our report.
In Cuba, like America, diabetes is a big problem. Cuban journalist José dos Santos was afraid his battle with the disease would cost him his foot. In America, 70,000 diabetes-related amputations are performed every year. But dos Santos was given what he calls a magic drug.
That saved my life.
What saved this man's foot wasn't magic, but Cuban science. There are 23 biotech labs like this one across Cuba, employing more than 20,000 people, where they're working on cures for everything from cancer to heart disease. Dr. Manuel Reises claims Cuban science differs greatly from the United States. He says Cubans create medicines that can help the most people, not make the most profit.
Since I wake up in the morning until I go to bed, I am doing my very best to serve the humanity.
And the world has taken notice. Heberprot, the drug that saved José's foot, is now being used in 26 countries. The Cubans say it has an astounding 80% success rate. Jorge Berlanga is the man who developed it.
If this drug becomes available in the United States,
it's going to be a revolution.
A revolution.
That's right, for sure.
The decades-old embargo has prohibited the drug's use in the U.S., but that may soon change. A number of American doctors believe Heberprot shows real promise, and they'd like to see it tested in the U.S.
This would make an enormous difference in the lives of people that are living with diabetes.
The Cubans say they are ready to help.
We would like to work as a team together to solve common problems, to show respect and be respected.
For many American diabetics, that can't happen soon enough. Harry Smith, NBC News, Havana.
So I'll start with Dr. DiFabio. Now, many people in this room might be surprised to learn that Cuba has such an advanced biotechnology industry. Can you tell us how Cuba came to develop this and to talk broadly about the industry and the regulatory process in Cuba?
Thank you so much, Pierre, for the invitation and the possibility of sharing with you my experience, recent experience of living 4 years in Cuba as the PAHO WHO representative. And thank you to all of you for being here to make this briefing more interesting. So as I mentioned, I went to Cuba in 2011 as the PAHO WHO representative, and for me it was a real fortune because my background, I'm a chemist. I work on vaccine development, vaccine research, biotechnology. So going to Cuba was a great opportunity to see closely what Cuba has developed in many years. Was surprised to see that Cuba has transferred technology to Brazil, but also to India, to China, to Algeria, to Russia, to South Africa. Cuba producing the technology and the knowledge and transferring that to other countries that are part of the BRIC countries at the moment. I mean, transfer technology to Brazil, to India, to South Africa, and to China, it's an important move. When trying to understand how Cuba reached that level, it starts from the very beginning. The higher authorities identify that the way for development and growth was human resources development. And that's what was implemented from the very beginning, to the point that, as you might know, there are over 140,000 doctors that have been formed in these 50 years, more than 30,000 from 100 countries. There are more than 12,000 masters in biomedical science, more than 1,000 PhDs. So that's where Cuba finds the resources, human resources, to be able to develop the research, develop the development of the research, production, and also to develop all those clinical trials. So it's no surprise when you are living there and you can see that experience, how a country could transform from being a developed country to technologically developed country. Parallel to this production, development, research and development, they have also worked on the regulatory process. I mean, they are aware from the very beginning that if you want to commercialize the products, you need a regulatory authority like FDA in the United States that it's able to control the processes of production, they can control clinical trials, and they are able also to certify the products. And that's what they have done. They have a regulatory authority very well known over the world called CECMED, it's Centro Estatal para el Control de Medicamentos. It's one of the national regulatory authorities of reference for PAHO. Among the 7, it's FDA, Health Canada, Brazil, Argentina, Colombia, Mexico, and Cuba, and they regularly meet and discuss regulatory issues. So I think Cuba has been able to develop from being a poor country, developed country, in technology to a level that can compete at the world market and also can compete with novel products, as we have seen the example of Heberprot-P. That's a novel product. There is no other alternative. I've recently heard about use of stem cells that could do something similar, but it's not approved, it's not being produced at the level that it's in development. So they have that, and they have also gone to cancer vaccines. That's another novel concept on medicine.
Just to follow up a little bit about Heberprot, the medication that you all saw in the NBC news clip. Cuba has a similar health profile to the United States, as I suggested in my opening remarks, including that the most common health problems are chronic and preventable diseases like diabetes. So is there anything at all similar to Heberprot in any country, in either in Europe or in the United States?
Well, not being an expert in the field, but from what one can read and look at, it's mainly wound healing. I mean, when you reach the level of wounds, it's mainly taking care of the wound, healing, avoid infection, avoid deterioration of the wound, or they reach the level of amputation, so it cannot progress. The Heberprot is like a growth factor. They have tried it topical at the beginning, but they saw that this protein gets very quickly destroyed, so it has no effect. So they start injecting it internally, allowing the protein to work for longer time, and there is like a healing. I mean, probably it's not the moment to show pictures of that, because
Well, actually,
I'm also a chemist.
We have a clip, I think, of sort of a before and after picture.
So, I mean, if you can see you can go from that wound to have an amputation or to recover at least the shape of a foot and being healed.
And that's a simple one.
Yeah, that's a simple ulcer. I've seen far more dramatic before and after pictures, and this is over a period of what, for 90 days, 60 days?
Yes,
something like that.
It needs several injections, and based on
Yeah.
that, the treatment can continue.
So can you tell us a little bit, some of you may have noticed in the news when Governor Cuomo of New York took a delegation to Cuba, he brought some researchers from Roswell Park. It's a cancer institute in Buffalo, New York, and they brought back a therapeutic lung cancer vaccine as part of an academic exchange to allow them to do some limited research. Can you tell us a little bit about this drug?
Well, yeah, I think you are talking about Simavax. It's a therapeutic cancer vaccine for lung cancer. And also that's interesting in the situation of Cuba. They have recognized that cancer was going to become the main chronic disease, main cause of death in Cuba, as in many countries. And last year they reached that level that cancer is the main disease, the main killer. So they start working on research, developing, try to identify products. Most of the treatments for cancer are chemotherapy or radiotherapy, which involves killing the malignant cells. But chemically, I mean, the chemicals used usually kill the cells, but also kill good cells. And radiotherapy also has that effect. Because the purpose is really to destroy the malignant nucleus, if you want to call it. The concept that Cuba has approached is, what if we control the tumor? So let's stop it growing. But the tumor will still be there, but it won't grow. It won't metastatize. It will stay there. As we do in case of diabetes, by using insulin. We don't get the cure, but you have a treatment that balances. And that's what they have worked in the therapeutic vaccine. The therapeutic vaccines, they have identified an antigen that has a role in the cancer development, and they develop antibodies by this vaccine. It's an epidermal growth factor. It's a factor that is important in epidermal growth, but also is very active in cancer, in some cancers. So they couple it to a protein to make it more immunogenic, so it will raise antibodies. And so by injecting the vaccine onto a cancer patient, it will be able to develop enough antibodies to control the growth of the cancer. They have also worked on a also very modern type. It's anti-idiotypic vaccine. It's anti-idiotypic monoclonal vaccine. So it's a very novel. That's called Vaxira, and it's another product that it's being used, and clinical trials are being developed in many countries. So it's a novel approach. It's how to live with a cancer under control instead of trying to kill the cancer, and probably you might kill the patient too.
Thank you. Do any of you in the audience have any questions for Dr. DiFabio about these wonderful treatments that have been developed in Cuba? Yes, over there.
Yes, even Heberprot-P is also based on epidermal growth factor. So it's one of the products that they have the biotechnological capability. But they are having transfer of technology like China. For the case of monoclonal antibodies, the Center of Molecular Immunology has a transfer of technology with China, and that plant in China is the biggest monoclonal antibody producing product in the world. So under those conditions, probably, my guess, Cuba might use the product being produced in China, and they will continue developing new products. And as an advertisement, sorry, I brought, yesterday I received from Geneva a document that we have produced in Cuba related to Cuban experience with local production of medicines, technology transfer, and improving access to health. So I have some copies, probably not for all of you, but if you are interested, I can get more and try to distribute.
Great. Gail, would you like to add something?
Yeah, along that same line, and talking about meningitis, when the WHO made the made the call for meningitis AC vaccine for Africa, when there was the great outbreak in Africa, Cuba transferred that technology to Brazil, where the actual production facilities were much larger. And so there was a collaboration, a South-South collaboration there to assist Africa to deliver several tens of millions of vaccine doses. The other interesting thing to me about meningitis has to do with meningitis B. We all saw very recently and very horribly that a number of US college students were stricken with meningitis B, and as it turns out, there's about 1,200 cases a year in the States and about, I think, 125 deaths. Cuba's had an effective vaccine against meningitis B since 1989, and it is one of its 13 diseases that they vaccinate children against in Cuba. Since I'm on the policy front at the end of this, I have to say it's unfortunate that we didn't have the benefit of working with the Cubans, because each meningitis B, you have to check me here if I'm correct. Each meningitis B strain is a little bit different, so you have to kind of tweak the vaccine. And while they were willing, there was just no way to do it over all these years. And so we've actually lost lives because of the lack of this cooperation.
Thanks, Gail. Was there a question back there? Anyone else? Yes.
I just wanted to say thank you for this great panel, and you may have been leading up to this, but I was going to point out that this happens to be November is Lung Cancer Awareness Month and Diabetes Awareness Month, and I was trying to think of a way that I work for Representative Charlie Rangel, and he cares very much about Cuba issues, so I'm going to see if I can do some social media link to this excellent presentation. Thank you very much.
That would be great. Thank you. I'd also like to mention that I was fortunate to be in Cuba the day the policy change was announced, and I'd been leading a congressional delegation, including Representative Rangel, and everyone else had gone home, but he was still in Cuba. So, needless to say, he was very much in demand.
Y'all were thanking him for the policy change.
Exactly.
So let me switch now and talk about disaster preparedness. Most of you may know that the Gulf, Florida and the Gulf Coast, from Florida to Texas is Hurricane Alley, and just south of that area of the United States is the island of Cuba, which is also smack in the middle of Hurricane Alley. Barbara, Cuba obviously faces the threat of hurricanes, probably to a greater extent than the U.S., but they seem to protect lives and property better than we do in the U.S. And as a case in point, there were 16 people who died in Cuba when a Category 4 hurricane, Hurricane Dennis, hit in July 2005. This was just before Hurricane Katrina, which killed 1,464 people in the U.S. It was a Category 3 storm. That's a big difference in terms of the casualty count. So can you tell us what Cuba does differently and what we might learn?
Yeah, the disaster response system in Cuba is absolutely incredible and impressive, and it's actually very sophisticated. So I'm going to give you only a nutshell of some of the points about the difference in systems, and there's also reference in your handout, which has statistics about Hurricane Katrina and Dennis. a document put together by Oxfam. But to bring it down into a nutshell, there are two things that Cuba does that really is different than us. One, and the most important, is that they don't leave people behind. You know, the people who died in Katrina who were people who, for one reason or another, either were unable to or failed to evacuate. And they do this by developing a safety net that very, very few people ever fall through. And if you look at just their organizational chart and kind of the things that they do, it's very similar to the United States. But what we do not have is a safety net. And that's who fell through, you know, in Katrina, again, also in Hurricane Sandy. So my interest in getting a deeper understanding of the Cuba system actually grew out of the fact that my disaster medical team and I were at the Superdome in Katrina, and realizing what a totally inadequate job we had done in the United States of protecting people. And having been to Cuba a couple of times at that point, I had a little bit of understanding of their system. So I went back to understand better what their system was, and, you know, and making comparisons. And so, you know, one of my conclusions is about how many people we leave behind, because we give out a mandatory evacuation message. That's what happened in Katrina. Then people need to scramble to get out. And what I saw in Hurricane Katrina was that by and large, people who had the means, actually most of them did leave. And that the people who I talked to, both at the airport and at the Superdome, were people who, for one reason or another, couldn't make it, and there were a lot of different reasons. When you look at the deaths that happened in Katrina in the United States are even more distressing when you look at the profile of who it was that died. 49%, virtually half of the people who died, were over the age of 75. This is a population that has so many barriers to saving themselves. Their lack of mobility, their likelihood that they would even have a car to be able to evacuate, the physical ability to save themselves, are all factors that get caught up and get mitigated by the system in Cuba. The Cuban evacuation is actually conducted by local people through local institutions such as the neighborhood associations, the healthcare system, the Women's Federation, which does a lot of the social support, and it's conducted by local people, so that the local officials, the people at workplaces, the people in schools, they tell me that they literally change their hat and then take on the role of conducting the evacuation or preparing their workplace. So that these are people who know the people who are there, who know the workplace, and they know the plans because they wrote them. It's an entirely different culture in the United States, where we tend to bring in outside consultants to write very fancy plans. And we have this joke, which isn't actually all that funny, among disaster preparedness people, that plan that's usually at least 2 inches thick in a real disaster, we use it as a doorstop, because that's what its usefulness is. And what is in your head and your understanding of your community and how you're going to save them is what really is important.
Thanks, Barbara. It sounded to me like you were saying that at least for the most vulnerable, that the Cubans do a better job with their evacuation procedures. Could you tell us a little bit about that?
So let me describe to you a little bit about what that safety net looks like. So in an evacuation, the evacuation is actually run by people in their neighborhood. It's the CDRs, the neighborhood associations, and they have the responsibility to make sure that everybody on their block or in their little catchment area has a plan and actually physically gets evacuated. The other level of the safety net is the healthcare system. Every single Cuban is attached to, as Tatiana was talking about, they have a medical home. They have a doctor-nurse team that knows them and looks after them. The local medical nurse team, doctor-nurse team, has the responsibility to review every single patient that they have and have a medical plan for them. So their fragile patients will get moved to the hospital early in the evacuation process to pass the hurricane. There are also women who are in their 9th month of pregnancy. Then people who maybe don't need to be in hospital but need medical supervision evacuate with their doctor to the government shelters so that they will have medical supervision, and the doctor has the responsibility, and the nurse, to bring the medications. And then people who maybe don't need that level of care but need to be under somebody's watchful eye, the medical team knows where that patient is evacuating to. So they've often described that they will go to Mr. Santiago's neighbor and say, you know, Mr. Santiago usually forgets to take his medicines. So he's going to be evacuating to your house. Please make sure, here's his medications, please make sure that he takes those. Other levels of assistance are people who have no medical problems but need assistance evacuating. That is the role of the Cuban Women's Federation. And they know, because they're neighbors, who needs assistance.
Gail?
Yeah. I am no expert on either disaster response or now what they're calling risk reduction. But having spent sort of more than 20 or 30 years most of the time living in Cuba, I can attest to the value of the local approach. I know that we don't have hurricanes here in D.C., but who knows, with climate change, we may sometime. But, you know, and it's, we got one in New York. So, you know, what do I experience? Well, I experience that at least a week before the hurricane is going to hit Havana, we know where we know it's coming. We know the trajectory, the potential trajectory. You know, there are different points of informing, warning, et cetera, et cetera. And we also know a lot about hurricanes. And then there are a couple things they do that would seem like common sense. When the winds hit a certain velocity, they cut the cooking gas and they cut the electricity. So if you step in a puddle, you don't have a live wire that's going to electrocute you. I mean, there are things like that that seem a bit like no-brainers, but that we don't manage to really learn from. They also evacuate pets and livestock, which was just amazing to me, especially in convincing older people. They want to evacuate their pets, you know. And so I think that this local approach, and in the mountains it's been very effective because they reinforce certain institutions, whether schools or a house or whatever, so people evacuate locally. They're not, you know, subject to a mudslide or to, you know, higher winds and so on. I think they do a good job. And I think that the collaboration that's been mounted so far between the two meteorology centers, one in Florida and one in Havana, has been extremely important, and would love to see more of the FEMA disaster response collaboration, because I think that, also I think Cuba can learn from the U.S.
Mm-hmm. Well, I'm going to ask the question that must be in everyone's mind is, so what? I mean, this is how Cuba does it. It works in Cuba, but can it work in the U.S.?
So I want to make two more points about their evacuation, and then I'm going to answer that question. One of them is that the way the evacuation happens, 85% of all Cubans actually evacuate to the home of either a neighbor or a relative. So only 15% evacuate to the government shelters, and they do not attempt to empty the city. Some of you will remember how very badly that went with Hurricane Rita, where people who were attempting to get out of Houston actually physically could not make it because of gridlock. Also, that created the vacuum in New Orleans that led to a lot more criminal activity, because they were hoping that the city would be empty. As Gail was mentioning, for the elderly, being able to evacuate locally also is less intimidating and less frightening. We actually do know that one of the reasons why a lot of the elderly don't evacuate is because it's simply frightening. They're getting confusing information, they're getting confusing advice as to what to do. They have a distance that they need to go in order to reach, and then they're going to be shipped to another state, you know, where they don't have their medications, they don't have their family, and those things. And by doing it locally and not emptying cities, actually the Cuban model seems to be much more effective. Also, the entire society is involved. So, for example, boarding schools, they release their students so that they can go home and pass the hurricane with their families. And then those boarding schools then convert to becoming shelters. Polyclinics, the community health centers, convert to being outposts of the emergency room. So the hospitals send strike teams and supplies out to the community health centers. So it's a combination of community health center staff and, you know, advanced strike teams that are then accessible in the community rather than trying to transport patients all of the way to a medical center that might be on the other side of the county. And everybody is involved. Everybody has a role. You can ask an 8-year-old, what are the stages of, you know, hurricane preparation? That it's information, alert, alarm, and recovery, and what their individual roles are. 8-year-olds also have responsibilities. Everybody is engaged, and they feel empowered because they have a part in that. So the question about how this applies in the U.S., there actually are models that overlap, such as our community health centers, our community emergency response teams. I think the CERT program in the United States is very, very valuable, along with the Medical Reserve Corps. But most of what I see is that we need a change in culture. What I saw in Cuba was that there is a society, that societies actually exist, where people feel that they're a part of the response, that they have a responsibility in the response, and that this is actually possible, that the locals take action. It's not just, I don't know if there's anybody here from FEMA, but it's not just FEMA, you know, like directing things from afar. And I also want to share that I have taken, through MEDICC, I have taken 2 delegations of U.S., mostly California, disaster responders down to Cuba to meet with Cuba's International Disaster Response Brigade, the Henry Reeve Brigade. And the interchange was so powerful because we're on separate courses. You know, we were coming from countries that, you know, at the time had no relations, and yet our experiences were so common. Those types of exchanges are so powerful. Also, medical students and doctors from the United States experiencing, you know, the healthcare system and seeing, you know, that a doctor has a role of actually looking at their patients and figuring out, maybe I should call this patient, make sure that they've got a plan. And for disaster planners in the United States, to see a system where it's not just a fancy paper that you had an outside consultant develop, but taking the responsibility and working closely. So until we can open again the exchange between the countries, it's something that you really need to experience. Those of you who have gone to visit Cuba, you realize you know, it's hard to believe that it really happens this way. But until you go and until we get that exchange, it's going to be much harder.
Thanks, Barbara.